Hi guys. So today we're here to discuss image-based questions which are asked in anesthesia in all the MCQ exams that we are studying for. All right. So we'll be taking up a few image-based questions and we'll be getting through them with discussing each and every topic in a little detail over here. Okay, so the first image-based question that you see here is this one. Now, here we've been given an image and the question says the drain tube orifice opens at, and then we're given 4 options. So first, before you look at the options, just see what is this image of. This image is of a supraglottic airway device. Okay, and this supraglottic airway device is a proceal. Okay, this is a proceal laryngeal mask airway. A proceal laryngeal mask airway is a modification of the classical LMA. Okay, the classical LMA had only the airway tube. Okay, it had an airway tube. The proceal was a modification of the classical LMA, in which with the airway tube we also have a drain tube over here. All right, this drain tube functions as a gastric port. All right, this drain tube functions as a gastric port, and this gastric port opens up in the hypopharynx, or to be very precise, at the esophagus. Okay, and hence prevents aspiration. Aspiration is prevented. Okay, so a lot of questions are solved here, and hence we can very easily solve this question here. The drain tube opens at the esophageal opening. It does not open at the upper end of the trachea. It does not open at the carina. It does not open at the vocal cord. All the other 3 options are wrong, and the correct option we get here. Now, let's just zoom in here and identify the other parts of the proceal LMA, so that just in case in future you're asked more questions relating to this particular topic, we're able to solve them very clearly. Okay, now over here, this is your airway tube. Okay, this is your airway channel. All right, this is the drain tube or the gastric tube. Okay, this part over here laterally, these are the cuffs. Okay, these are the inflatable cuffs. All right, this is the 15 mm universal connector, which is present at the machine end. Okay, this assembly over here, this one is the pilot balloon with the one-way valve here. Okay, and this here is for attaching the syringe for inflating the cuffs. All right, simple. Now over here, this is the drain tube orifice about which the question had been asked. All right, done. Now let's move on to the next question. Now let's just zoom in and see the picture first before going to the question. This is a man here who is compressing the lower part of the chest or the upper part of the abdomen here, and this man looks like he is choking. There is some obstruction happening because of which this person is unable to breathe properly. All right. So the picture depicts which of the following maneuvers. All right. Now for choking, for a patient who's choking on something, the maneuver which is used is Heimlich maneuver. All right. In Heimlich maneuver, another person makes a fist and compresses on the lower part of your sternum. All right. The lower part of the sternum is compressed from behind in a choking patient, so that whatever contents have been aspirated by this choking patient, they get pushed out and the patient throws the content out. All right. So here is our answer for this. All these are the incorrect ones. RSI, alveolar recruitment, head tilt, these are not the maneuvers that we use for a choking patient. Okay. Question 2, done. Now, let's come to the next question. What is this vial depicting you here? This is rocuronium. What is rocuronium? Rocuronium is a neuromuscular blocker. Okay. Now, rocuronium is a neuromuscular blocker which acts at the neuromuscular junction. How does it act? It is a competitive blocker. What does it compete with? It competes with the naturally occurring acetylcholine, which is present at the neuromuscular junction, to get attached to the nicotinic muscular receptors, so that once rocuronium gets attached, no further impulse transmission occurs, no further contraction of the muscle can take place, and the muscle goes into a phase of relaxation. Okay. So what is it? Rocuronium, here we get, it is a non-depolarizing muscle relaxant. It does not depolarize it. It just acts directly in a competitive manner and blocks the transmission of impulse completely there. So it is a competitive. We've got 2 points here. Now, neuromuscular blockers, they are classified according to the structure. We have a structural classification. We have 2 types. We have benzyl isoquinoleums. Okay. And the other ones are aminosteroids. All right. Now, rocuronium, it falls into the category of aminosteroids. All right. So, this. Hence, all of the above is the correct answer over here. Okay. Now, let's move on to the next question. What is this particular tube? Now, this tube is a DLT. We've got 2 lumens over here. You can see this is one lumen here, and then there is another lumen here. There are 2 balloons here. One is here, one is here. There are 2 pilot balloons here. One is here, one is here. Okay. So what is this? This is the double lumen tube. Okay. A double lumen tube. It has got 2 cuffs. Okay. Now we've got a bronchial cuff and a tracheal cuff. The bronchial cuff is blue in color. The tracheal cuff is white in color. Okay. This is the bronchial cuff. This is the tracheal cuff. All right. Similarly, you can differentiate with the connectors. The bronchial cuff will be a blue connector and the tracheal cuff will have a white connector, and similarly, the color coding for the pilot balloons is going to be there. All right. Now, let's come to the point where we need to know what are the double lumen tubes actually used for. Now, the double lumen tubes, we've got two lumens. One lumen is ending here and one lumen is going further down into the bronchus. Now, why is it happening? Why do you want to maybe ventilate only the bronchus? So, you want to ventilate only the bronchus when you want to isolate one lung from the other. This is used for lung isolation surgeries. All right. Now, lung isolation surgeries will happen when you want to keep this lung inflated and this lung deflated. For example, why will you want to deflate this lung? Because you will want to have more surgical space on the lung which you have deflated on that particular side. All right. So you'll have more area for you to operate on. All right. So in thoracotomies, you can use it. In aneurysm surgeries. Okay. All right. So these are the surgeries where you use it for. So of course, it's not used in laser surgery. For laser surgery, we have special tubes, laser tubes. Lung isolation surgeries is where you use it. Cleft lip and palate, no. For cleft lip and palate, you have separate tubes, which are the RAE tubes, all right, in which you have North Pole and South Pole tubes. And for spinal anesthesia, you do not use tubes, you use spinal needle, okay, or the Quincke's needle, all right. Now, let's go on to the next topic. Now, this next question over here, we see that here is a picture of the drug. It's even mentioned here. A lot of times, you'll get little hints in your question itself. So, be careful about that. Now, Scoline is the drug which is represented here. Scoline is contraindicated in, and here we're given the options. All right. Now, Scoline causes one side effect itself, which is hyperkalemia. All right. So, any condition which itself will have hyperkalemia present in it, we are going to not use Scoline over there. All right. So, in burns patient, a burns patient has hyperkalemia. All right. It's a dehydrated state. The patient is in acidosis. The patient is hyperkalemia. We're not going to use Scoline. This is reason number one. Secondly, in a patient of burns, we have got proliferation of extrajunctional muscarinic receptors. Okay. So that is another reason why we do not use Scoline. Okay. Because it is going to act on the extrajunctional nicotinic muscarinic receptors because of excessive proliferation. Till what time do you avoid Scoline in a patient who has suffered from burns? That's about 1 year. Till 1 year, you avoid giving Scoline. All right. This is another question that can be asked over here. All right. So, of course, burns and hyperkalemia, in both these conditions, we are going to not use Scoline. Then is crush injuries. All right. Now, crush injuries are injuries where again hyperkalemia is seen. Hyperkalemia, rhabdomyolysis, acidosis, metabolic acidosis. All right. So these are the things that crush injuries have. So obviously, again, we are not going to use crush injuries. Hence, the answer over here is going to be all of the above. Okay. Once you have a little knowledge about the drug, it is going to be very easy for you to crack these questions. So it is always important to make your basics strong as possible. Okay, there's no need to, learn them and, just keep doing n number of questions and not go through theory. That's a wrong approach. Once you have your theory strong, when you have your basic concept strong, you'll be able to crack as many questions as possible. And the more the number of questions thrown at you, you'll be able to do it in a jiffy. No problem there. Okay, now let's go on to this question. All are correct about the image shown except. Now first see, this we have even gone through in the class. Okay, now this over here represents what grading? The mouth is open, the patient is saying ah, and you can see the oral cavity and its structures. This is very easily answerable for you. This is the MPG grading or the Malam Patti grading. Interesting name, interesting concept. And what does it tell you? It tells you about the ability for you to easily or with difficulty mask ventilate a patient. Okay, this is not something which is used for intubation. Remember, for intubation there is another scoring system that we use to assess the difficulty of intubation. We use CL grading or Cormack-Lehane grading. Okay, so this is another question that can be asked in future. All right, so this is the Malam Patti grading, of course. All right, and it helps identifying cases with difficult mask ventilation. Correct. It is not influenced by tongue mobility and size. This is doubtful. Okay, it is definitely influenced by your tongue mobility and the size. All right, it is what is Malam Patti grading? It assesses the size of your tongue with respect to your oral cavity. So this looks like it can be an answer here. Has limited utility in reduced neck extension. See, if the neck extension is not adequate, and the patient is not able to move his neck, his or her neck, then this entire grading is useless for you, because as it is going to be a difficult patient for you to mask ventilate, because to mask ventilate you also require to make tilt the head. You require the patient to extend over here and have a position which is known as the sniffing position. We've read about that in our previous lectures. So of course it's going to be useless for you, even if the patient has an adequate mouth opening and you can see all the structures, but has a limited neck extension. Not of much use. So looks like C is the correct option here. Option or the correct answer here. Okay, so we have our MPG grading here. In MPG grade 4, what can you see? Just to revise here, grade 1, grade 2, grade 3. In grade 1, you can see the hard palate, the soft palate, the uvula with its tip, the fascial pillars, the tonsillar pillars, and the posterior pharyngeal wall. All right, in grade 2, you can see the hard palate, you can see the soft palate, you can see the base of the uvula. In the MPG grade 3, you can see the hard palate and the soft palate. And in grade 4, you'll only be able to see the hard palate. So this is what you have to know about MPG grading here. Okay, simple. Now let's go on to the next picture. What is this next picture? Looks like it's some sort of an airway. Okay, looks like it's some sort of an airway. Is it a supraglottic or an infraglottic airway? It's a supraglottic, because it will remain above the glottis. It is not going to cross the vocal cords. So it's a supraglottic. This answer is wrong. Laryngeal mask airway, it does not look like. We've just been through the picture of laryngeal mask airway, so forget about that. Now, Goodell's airway and nasopharyngeal airway. Well, Goodell's airway looks nothing like that. Okay, we've read about that in our previous lectures as well in our class on airways. But just to recapitulate it over here, Goodell's airway is made up of plastic. Okay, it's not this soft. Whereas the nasopharyngeal airway, it is made up of silicone. And it is soft and easily tolerated. And it is how is it put? It is put after adequate lubrication with lignocaine jelly, and it is put in a rolling fashion. Okay, slowly in a rolling fashion through your nose, and it is put in which nose? You always assess the patency of the nose. Okay, how do you assess the patency of the nose that you have to put it in? You do a spatula test. Okay, a spatula test or a cotton wisp test. These are the two tests that you do. All right, once you've assessed for the patency, you put it in a pin rolling fashion and go in and maintain the airway. How do you measure the size? How do you measure the size? You take it from the nasal tip up to your, up to your tragus. Certain books also say that you measure it from your nasal ali up to the tragus. Okay. So this is what you need to know about nasopharyngeal airways over here. Now, next comes cannulas. Okay, cannulas. The cannula shown over here, this is a pink cannula. Now, the pink cannula, the question here says, what is the size of the cannula that is shown? The pink cannula is an 18 gauge cannula. This is something that you will have to learn, and you can just, write it on a piece of paper and stick it to your wall so that you just keep going through it every now and then. So until unless it gets imbibed in your head and it's on your tips, because it is extremely important in your clinical practice as well. So what is an 18 gauge cannula? 18 gauge cannula is a large bore cannula. It is green in color. Then we have your 20 gauge, which is the pink one. Okay. Then we have your 22 gauge cannula, which is blue in color. Then we have a 24 gauge cannula, which is yellow. Okay. Then we have a 16 gauge cannula, which is gray in color. Then we have a 14 gauge cannula, which is orange in color. Okay. Now, just to tell you, this is a step ahead than what has always been routinely asked. You can also be asked about the flow rates here. Different brands have different flow rates, but you need to remember a rough estimation of the flow rates of the cannulas. Okay, so the flow rates of the cannulas, these are about 100 ml per minute. This over here is about 60 ml per minute, or to be precise, 67. This is 31 ml per minute, and this is 13 ml per minute. Okay, and this is roughly 250 ml per minute, and orange corresponds to about 300 ml per minute. Okay, this is a rough estimation which you need to remember. Okay, now let's go on to the next question. Toohey's needle, this has been shown in the picture here, is used for, this is something that you have to learn. Toohey's needle is used for epidural. It's not used for spinals. For spinal, we use Quincke's. Okay, which is a dura cutting needle. Quincke's needle is a dura cutting needle. Dura cutting needle. These needles have more chances of PDPH. Okay. Then for general anesthesia, we do not use these block needles. And for femoral nerve blocks, again, we do not use a Tooheys needle. We do use separate needles for electrical stimulation and ultrasound guided needles. Those are the ones that we use. Okay, so this solves your question over here. Now, the next question over here is of a picture of a cylinder. Okay, the image shows which cylinder. Now, you see oxygen cylinder, it has a body of black block, okay, a black body and white shoulder. So this is what we see. This is a white shoulder and this is a black body. Nitrous is blue. Halogen does not come in cylinders. It comes in your vaporizers. And carbon dioxide is gray. So again, easy question. If you know about cylinders, it's a cylinder which represents oxygen. Okay, so these were your image-based questions. This was the session 1 of our image-based questions. I would again emphasize on the fact that if your basics are strong, you have a thorough knowledge about your anesthesia basics, it is going to be very easy for you to solve these questions. And whenever you're studying anesthesia, keep looking at the relevant pictures side by side so that your image-based questions are also solved alongside. All right. So I'll see you in the next session. Bye-bye.